Hello everyone, and welcome to Restorative Health Solutions. If you understand what's making you sick, then you can start to understand how to get better. More information is power. Hello, I'm Dr. Warren, and today I want to run through an article about why and how patients struggle to find a diagnosis for Lyme disease. I was actually doing another video on specifically how rheumatologists often miss Lyme patients, and we came across this terrific article about medical gaslighting of Lyme disease patients, which was just published in January of 2024. I'm recording this in March and thought it was so important that it's going to make its own separate video. So this is kind of part of the theme of why and how you're getting missed in this current medical system. And let's just kind of dive in to understand you're not alone. You understand that a lot of these kind of falsehoods are being told to many people. And this Lyme disease problem is just really a huge issue in the medical community right now. And it's not necessarily your fault that you're getting missed. So this was published, as I said, in January 24, and it's called Medical Gaslighting and Lyme Disease, which is basically, gaslighting is a term kind of, I would describe it as just blaming you for being sick, but kind of almost making the patient feel bad, or making you feel bad that you have something that the doctor doesn't understand real well, which is all backwards. So in the abstract of this study, even though there are approximately 500,000 new cases of Lyme a year, so just under 500,000 is the current estimate, the CDC has acknowledged now that Lyme can become a chronic multisystemic condition. Now this is new. For 30 years they said no, it can't, it's only acute, it can't become chronic, it can't become, your nerves and your joints and all these different things. Then 2 years ago they said, oh, it can. And they think it happens 10 to 20% of the time. We have that in multiple other studies. Okay. Now, both acute and chronic Lyme disease, particularly chronic, are still considered to be contested illnesses, and this creates a lot of confusion for doctors, including medical gaslighting, which basically you go to the doctor and they tell you the wrong thing. So, what are Lyme symptoms attributed to? Here's your top things from surveys taken out in this study. 1, mental illness. You're not really sick, it's just a mental illness. You're anxious, you're stressed, or you're old. And all these things are wrong. Of course, symptoms from Lyme come from arthritis and inflammation, and they do have a lot of neurological problems, so it does look like MS or like a psychiatric illness to people, but what's bothering the nervous system, what's bothering the joints is Lyme all too often, and it's missed. Also note here that the severity of the symptoms, such as pain, were very much underplayed. So once again, you go to the doctor, he says it's nothing, maybe you're depressed or anxious. And they say, no, maybe you're just getting old. And this is literally one thing happened to us. So in our family, I got pulled aside and told that a family member was seeking attention. And I was like, no, I think something's wrong, and you're missing it. So this happens, and it leads to really frustrating patient experiences, family experiences, where the person who's sick actually just gets not served well. And this is the top things that doctors will assign Lyme disease symptoms to, and this is very sad. Okay, another thing we get told is respondents to this survey get told that chronic Lyme disease does not exist. Again, this is just a problem because they use the word fruitless consultations. So you get sent then, because chronic Lyme disease doesn't exist in the doctor's brain, you get sent to an umpteen amount of different doctors in this wild goose chase trying to figure out what you have because the Lyme disease gets missed. So this study particularly found that there was a median of 10 different doctors people had seen before they found out they had chronic Lyme. And they referenced 2 other studies, one that showed an average of 5, and another that showed that over half of 2,400 respondents had seen at least 7 different doctors. So the problem here is your symptoms get written off as you're old, you're anxious, you're mentally ill, you're stressed, and then you bounce through the system seeing this doctor, and then you get a referral to rheumatology, and then you get a referral to neurology, and then you get a referral to psychiatry. So you just start bouncing through the system, and nobody really knows what to do with you. You have to wait months and months for all these appointments, and it's just very frustrating. Some highlights from the study that I thought were super interesting was part of what they said is if you have the EM rash, which is that bullseye rash that's famous for Lyme, that doctors are still missing Lyme even if you have the bullseye rash. Now that's supposed to be kind of the dead giveaway to doctors, is if you have this rash following a tick bite or following being outdoors, it should really be a slam dunk that it's Lyme. And they're even missing that. By as many as 500 people still said they were missed. Their doctor was unconvinced even after a bullseye rash. That really shouldn't be happening. We have doctors discounting even a positive test. This is wild data to me. Analysis reveals that a patient's positive blood test status did not influence how likely a doctor was to believe the patient had Lyme disease. So 79% of doctors, even with a positive test, were saying, no, it's not Lyme disease. This is wild to me because the current test setup is, there's really not false positives. There's lots of false negatives, but there's not false positives. And the doctors are maybe confused because the doxy's not working for them. We kind of explained that there, but I think this really, to me, when I go through this article, it really shows how doctors have multiple steps that Lyme disease is missed, and it's kind of, I tell people it's about 8 different problems all stacked on top of one another, but here's 4 just in this study they highlight. 1, they don't really find the EM rash, even when it's there, they're missing it, so you don't get diagnosed with Lyme. They're not ordering a test. This is another study, another thing from this study. They're about half to a third of the doctors are just refusing to order a Lyme test. That's not even to say that the test they're ordering is a good test, but they're not even ordering the standard test. So people are getting below the standard of care, which I don't even think the standard of care is very good, but people are getting below that. And next, even if the test is positive, they don't believe it. I've got my 3rd mistake. Then the 4th thing is, we know from studies that when you're giving out doxycycline, if you get it in the first month or so, it works great. By 60 days, it doesn't work nearly as well. So if you're bouncing to doctor to doctor to doctor, it takes 9-10 doctors to find Lyme. It's probably been 6 months, a year, 2 years. And by that time, the 2 to 4 weeks of doxycycline is simply not enough. You really do have to catch it quickly. So when we have problems catching it quickly, it's just mistake upon mistake upon mistake, and then we tell the patient they're anxious and tell the patient they're old and it's happening to you. It's happening to you and your family, and it's just bad. This is kind of one of my highlights here, is really this study shows that they're missing some of the easy ones. So mainstream medical is missing a lot of the easy ones. People who come in with arthritis, flu, rash, positive tests, they're still being missed. Well, how are they then going to find the hard ones? So half the people who have Lyme don't have a rash. Well, if they're missing the people with the rash, you're going to miss the people without the rash. Okay, well, the test misses a third of people. Okay, but even if the test is positive, they don't want to do treatment for it. Okay, so what about a neuro-Lyme case that's not presenting with your classic symptoms, but is presenting all neurologically? It's not going to be attributed, to Lyme, and this is one of the main issues that we highlight is things get put in other categories, not as coming from Lyme disease when they really are. Now, another fascinating part of this study is, well, certainly doctors in Lyme-endemic states like Minnesota and Wisconsin are much better than, doctors from Texas or doctors from Missouri, where, Lyme isn't as well known and it's not as regional. Well, really, this study kind of blew that out of the water and was like, nah, it's still pretty bad in Lyme-endemic states. So, of the doctors who refused to administer a Lyme test, about half said, yes, we'll do a Lyme test, half said no. The LE states are Lyme-endemic states like Minnesota and Wisconsin. Okay, so it's about 50-50 in there. Now, if you're in like Texas, a non-Lyme-endemic state, it was 130 to 69. So less likely, but it's not like Minnesota, Wisconsin did fabulous here. This one's really scary to me, the second one. Doctor assumed you were a drug seeker. This is happening at least 2/3 of the time, and you're getting flagged in your system for seeking out pain meds, and you're getting labeled and falsely accused of things because you have symptoms, and doctors think you're seeking medication that you don't need. This one down here, doctors still unconvinced after a Lyme test diagnosis. 123 yeses and 48 no's. That's just wild in the Lyme endemic state. It's even worse in non-Lyme endemic states. So even if you get a positive test, doctors are going, no, it's not Lyme. And I think this number has to do with, well, they're recognizing that, if you've had this for 2-3 years and I give you 2 weeks of doxy, it doesn't do anything. So that's why they're unconvinced, because they're told, well, the doxy works great. Well, it doesn't work great if you're late. It only works great really right away. Misdiagnosed with an autoimmune disease. This happens a lot because Lyme can look to many people like a rheumatoid arthritis. So it looks like RA, it looks like lupus, it can look like psoriasis, it looks like some of these HLA-B27 arthritises. So we often get sent to rheumatology because of the arthritis component, and then we get diagnosed with some kind of autoimmune disease, and that can be coming from the Lyme, or you're just not fitting in those boxes and it's really coming from Lyme. I get a lot of weird diagnoses from rheumatology because you don't actually test positive for those. So they'll say things like, well, all your rheumatoid arthritis tests are negative, but we're going to diagnose you with rheumatoid arthritis anyway. Or, well, all your tests are negative, but we're going to diagnose you with psoriasis anyway. And it's a little confusing, because once again, you're not presenting like a true rheumatoid arthritis case. You're not presenting like a true psoriasis case. Or it gets a little fuzzy because you're not fitting into those categories either. But that's about half. It's about 50-50 in Lyme endemic states, 88 to 91. And in non-Lyme endemic states, it's 156 to 119. So we have tons of misdiagnosis happening where you're getting chunked into this kind of autoimmune category when Lyme is really there causing problems. And then on the bottom here, they do highlight some things about kids. It's a shame when it happens to adults. It's also really hard when it's happening to a child, and we're into kind of misdiagnosis of a child and what that does to their life and their ability to participate and grow up and do all these things. So, is there a better chance in Lyme endemic states like Minnesota? Unfortunately, it's not that much better. It's certainly not as good as I feel it should be, even in these states. In closing, I want to read just a little bit of their conclusion about the geography of this. Patients in non-Lyme endemic states encountered more doctors than patients in like Minnesota and Wisconsin who told them they could not possibly have Lyme disease because there were no ticks or no Lyme disease in the area. I do want to highlight that I do not believe Lyme is as regional as people have thought it to be. This really has not been investigated thoroughly, so it's kind of a bunch of old assumptions. Lyme disease comes from ticks, particularly deer ticks. And if there are deer anywhere near you, there are deer ticks near you. And so I tell people, if you're anywhere where there's deer, then there's a possibility there's deer ticks and there's Lyme disease in and around those areas. Finally, there was a marginally significant result showing that in your non-Lyme endemic states, so in Texas, down south, not the Midwest and the Northeast. When you're not in these Lyme endemic states, we found that doctors are more likely to just tell you all your symptoms are in your head. And this is a shame, and this is hurtful, and it's things we want to avoid as doctors, telling people that it's all in their head when it's really coming from an infection. For those of you looking for comfort, I'm going to try to finish and swing on a positive. So chronic Lyme is real. We are thankful that after 30 years of fighting, the CDC has acknowledged in spring of 2022 that chronic Lyme's real. That's a big step forward in getting this disease recognized and in helping you not slip through the cracks of the current system. That said, they spent 30 years saying the opposite, so it's going to take some time to unwind some of these problems. The NIH is funding research on Lyme also for the first time, starting last summer of 23. That's good. More research is good. Also, we do have continuing research going from people like Johns Hopkins, Tulane, Columbia, MIT, and others. That's all exciting, and it means it's coming. It is coming, but it is a long way away. Most of the research, when you're looking at the studies being done, is still really just aiming at defining how big of a problem this is and trying to convince the greater scientific community that it is a problem and we need more funding to put towards this problem, because a lot of people are falling through the cracks. Once again, estimates are 10 to 20% of people are going chronic. There's about 500,000 people sick a year. That's 50 to 100,000 Americans who are suffering with chronic Lyme and are kind of ping-ponging through the system, seeing lots of doctors, everything we just talked about a year. 50 to 100,000 Americans a year is many, too many. In Minnesota and Wisconsin, we have about 50,000 each, so 5 to 10,000 Minnesotans, 5 to 10,000 people from Wisconsin every year. it's just too many slipping through the cracks of the current system. Also, mainstream medicine, while they're jumping onto Lyme, they really are not any of the co-infections yet. And really 93% of people who are chronically sick have these co-infections, Bartonella, Babesia, Anaplasma. We're really not there with any of the current research. So they still have a long way to go to understanding Lyme and the co-infections and the chronic Lyme to really be successful. So we're excited that there's more of these articles coming out, because I think better patient care is so needed in this area. But for you can be healthy. You can live your life. There are so many doctors like myself who dedicated their life to helping you in this circumstance. So if you're frustrated and you can't find the source of your symptoms, then especially if you live in a Lyme-endemic area or really anywhere there's deer, really a very, very thorough, the most up-to-date thorough Lyme testing and co-infection testing is really what I'd recommend to make sure this is or is not a huge factor in what's driving your health problems and preventing you from living the life of your dreams. I'm Dr. Warren. Hope you found this helpful.